Okay, and at this time, I'd like to welcome those who have registered for today's Blue Ridge Health District COVID-19 Town Hall, along with those who have tuned in to the live stream. My name is Joe Rice with the City Communications Office. We are hosting this Zoom webinar, and I'll be moderating today's Q&A between our BRHD representatives and the community. Just a few notes before I hand it over to Jason Elliott, the Blue Ridge Health District's Deputy Public Information Officer. After the presentation, the panel will address questions that were submitted by the public earlier through an online form. And after those questions are complete, we will give our registered attendees an opportunity to ask questions as well. We will host one round of questions with a follow-up. If time allows, we'll continue with a second round of questions. And as always, please keep your questions respectful and thoughtful for all of our participants, and we appreciate your participation. And with that, I'll hand it over to Jason Elliott.
Thank you, Joe. And thank all of you for being here. Welcome to another town hall with the Blue Ridge Health District. As you heard, I'm Deputy Public Information Officer Jason Elliott, and I'm joined today by our Medical Director for the Blue Ridge Health District, Dr. Denise, our Vaccination Program Manager, Jen Fleisher, from UVA Health, Dr. Jeff Vergales, and from Pediatric Associates, Dr. Paige Perriello. We're very excited to give you plenty of updates today, and we're looking forward to your questions at the end of our town hall. So with that, Joe, if you can go to the first slide, we'll go over our agenda for today.
Will do, just 1 second.
Thank you. Actually, I know the agenda, so while he's pulling that up, I'll go ahead and just tell it to you. How about that? So we're going to start today with some vaccine information for you, give you a little update on our data and our vaccine counts. And then we'll talk about some of our vaccine resources as well as testing resources throughout the Blue Ridge Health District. And from there, we'll move into some recommendations from both the CDC and the Blue Ridge Health District for masks and back to school safety. And then we'll wrap up today's town hall with questions and answers from you, the community. So Joe, we'll jump to slide 3. All right, so here's our updated vaccine data for the Blue Ridge Health District. As you can see, these numbers are continuing to rise, and we have it broken down here by individuals who have received at least 1 dose, as well as those who are fully vaccinated. The math on this works out to about 61.8% of the Blue Ridge Health District having at least 1 dose. And we're sitting now at 56.5% of our Blue Ridge Health District being fully vaccinated. We do continue to host vaccination events throughout the community, both fixed sites and mobile sites, and we'll talk about that in just a moment on the next slide. So here we are getting a lot of questions on how to access both vaccines and testing. And so we wanted to give you an update on how you can receive your vaccine here in the Blue Ridge Health District and touch on a couple of updates for our testing endeavors as well. So for vaccines here in the Blue Ridge Health District, there are a number of ways that individuals can access vaccines. And we wanted to go over those with you real quick. So we do have our J.Crew fixed site. This is on 29 North at the Fashion Square location. And we are operating 4 days a week there, which include daytime and evening hours. In addition to that fixed site, all of our local health departments are now offering vaccines 1 day a week at each location. And the hours and times for both the J.Crew and local health department vaccine sites are on our website, which we will put up at the end for you as well. We have our shot on the spot events, which you've probably seen some flyers going around. And this is what we're really excited about because it takes our vaccines from a clinic and into the community. So we use our wonderful Mobi, the mobile unit, and we are out into the streets, making sure that anybody anywhere has access to this vaccine. So coming up, you'll see us at West Haven Health Day this weekend. We'll also be out at Lake Anna this weekend. And the whole list is also on our website there. But we're very excited for our shot on the spot events, and we've enjoyed seeing everybody come out to those. In addition to our community efforts through our mobile vaccines, we also are still partnering with UVA Health and the Charlottesville Fire Department to provide homebound vaccines for individuals who are unable to leave their home or access one of our community or fixed sites. The added bonus to this is that we take care of everything for your first and second dose, and you can get that smoke detector set up or that battery replaced if you need that as well. So we've really enjoyed that partnership, and we've enjoyed coming out and seeing you in your home. In addition to the Blue Ridge Health District specific events, several local pharmacies and providers do have access to the vaccine and are providing those throughout the community. And you'll see here on the graphic to the side, you see some of our CVS and Walgreens locations for testing. Those individuals can be contacted for vaccines, as well as places like Walmart and Costco, Sam's Club, and some of our local pharmacies as well. So if you do have a question on accessing a vaccine, the best option for those would be to contact that pharmacy or provider directly. Kind of hand in hand with vaccine these days, particularly as we see our case count increasing here in the Blue Ridge Health District, is the importance of testing. And we do want to remind everyone that testing is still widely available throughout the health district, and it is very important during this time to ensure that we are limiting the spread of COVID-19 throughout our community. Each and every Monday, our partners over at UVA are hosting free testing at the Church of Incarnation, and on Tuesday nights, they'll also be at the Mount Zion First Baptist Church. The Mount Zion First African Baptist Church in Charlottesville. Every Friday, we are hosting a testing event at the Charlottesville Albemarle Health Department. And as we're moving forward, we're also increasing those efforts to be on a regular routine throughout the rest of the district, offering free testing as well. Like we mentioned earlier, several local pharmacies and providers are also still administering COVID-19 tests. And all of that information is on our website. So you can access testing that is convenient for you. In addition, if you are in a location where you feel testing is necessary and you would like some questions about setting up another test site, please reach out to us, because we are able to to work those in as needed as well. Next slide, please. So with that, as you all may have heard last week, we did get some updated guidance from the CDC on masks. So we're going to turn it over to Dr. Denise Bonds, Medical Director for the Health District, to let us know what the CDC is saying and what the Blue Ridge is recommending. I'm making up words today. Dr. Bonds.
Thank you, Jason. So many of you heard the press release from the CDC last week, and let me just talk a minute about what's changed. I think we had a lovely couple of months where, as vaccinations increased, our case counts went down. And unfortunately, in this country, we have had now an increase in what's called the Delta variant. So this is COVID is a virus that can change as it moves from person to person, and we call that mutation. And in this situation, we've developed one called Delta that does seem to be pretty transmissible. And importantly, if you're vaccinated, the vaccine is working. It's keeping you out of the hospital and lowering your symptoms. But we have found through studies that if you're vaccinated and infected with the Delta variant, that you are capable of spreading that virus to other individuals. And that's really been driving the change in the guidance that we see, both the CDC and locally. So what the CDC has now recommended is that if you are in an area that's having substantial or high transmission, and you can find that on the CDC website, or you can find it on the VDH website. They're actually retooling that website right now at the state level so that it matches the CDC. So if you live in a community or you work in a community that's at substantial or high, the recommendations are that when you go inside to a public setting, that you put a mask on, whether you're vaccinated or not. Certainly anyone who is unvaccinated, or if you have a medical condition that puts you at high risk, because you're immunocompromised, or perhaps because you have lots of medical issues that if you did get sick might be problematic for you. That in these circumstances, the CDC and Blue Ridge Health District would also recommend that you wear a mask inside. I'm going to add here too that if you are living with someone who fits that definition, or are a caregiver for someone who fits that definition, then you probably should also wear a mask, because you could become infected with this Delta variant not know that you were sick and then spread it to the loved one that you're caring for that perhaps has an immunocompromised condition, or you have a child that's under the age of 12 and is just not eligible for a vaccine. If you are vaccinated and you know you have an exposure to someone who had a diagnosed case of COVID, the recommendations are that you get tested 3 to 5 days after that exposure, and that you wear a mask while you're out in public for 14 days or until you have that negative test result. And again, that's because we know with the Delta variant that you can become infected, have very mild or no symptoms if you're vaccinated, but still be capable of shedding that virus to other individuals around you. And, you know, I think we all have loved ones that really just can't afford to be sick with this virus. And then the CDC did recommend that for all school-age kids, there be universal indoor masking regardless of vaccination status. And so I think you'll see that many of our schools have adopted that as well. Can we have the next slide, please? So let's talk a little bit about back to school recommendations. And again, this reiterates, I think, a lot of what we just said. The CDC has recommended and VDH has endorsed that if you're going back to school, everyone wear a mask. And that's the recommendation that, again, has come out from the CDC and been endorsed by both the Virginia Department of Health and our governor as well. We do know there's a press conference at 2 o'clock, and so there may be some changes forthcoming. We just don't know at this point in time. I don't have any inside information about that. So stay tuned for the 2 o'clock press conference from the governor. Certainly, as I said, if you're a vulnerable vaccinated individual, you have chronic medical conditions, or you live with someone who is either unvaccinated or is medically vulnerable, you should really think about strongly wearing a mask when you're in an indoor location that might put you at risk of becoming inadvertently infected. And so now I wear a mask when I go to the grocery store again, or when I go out to a public setting. And I think that's just good practice, knowing how rapidly spreading the Delta variant is, and that I don't want to be responsible for spreading that to somebody else. And then, of course, we should always welcome anyone who feels more comfortable wearing a mask to have that extra degree of protection from becoming infected. It's always a reasonable strategy to assume. Can we have the next slide, please? So here is our hotline number and all of our contact information. And Jason, I am going to turn it back over to you.
Great. Thank you so much. And with that, we get to the question and answer portion. So there have been a couple of questions that are coming in. And before we get going for our live questions, we want to take on some of the questions that were sent in through our survey that we sent out with our newsletter this week. So if you have not yet signed up for that newsletter, please make sure that you do that. And then you'll be able to see the survey going out for questions ahead of the town hall next time. But we're going to go ahead and get going. Dr. Bonds, you were just talking about masks. And so on that topic, specifically, one question that came through is, what is your recommendation for masks when it comes to gyms or indoor athletic practices and things like that as we get back into school?
Yeah, I mean, this is a great question, and it's a really hard one because, of course, it's, you know, wearing a mask can be uncomfortable. So my recommendation is, if you're going to exercise indoors and it's a public gym where there's lots of people, I would wear a mask. I have an exercise class I do every week without fail. And every week I put my mask on, and everyone else is also masked in that class. And it's fine. We figured out a way to do it, and I am pretty comfortable now doing that. So you have to try a couple of different types of masks to make sure that you've got one that's really going to fit well, that while you're exercising, that's not going to get soggy if you're someone who sweats a lot when you're exercising. But I would certainly do it. If you're really worried about it, outside is always safer. And we've had a couple of really beautiful days right now. And so this might be a great time to think about going for that outdoor walk or running outside rather than being in the gym. But certainly if you're going to do that exercise class, you're going to go in and work out, I would encourage you to wear a mask and find one that fits you comfortably.
Thank you. And while you're on the hot seat, I'll go to question number 2 for you. And kind of related, because you mentioned some indoor-outdoor activities. And we had one parent reach out and say that their school is hosting an overnight type of retreat. And basically, they're wondering, how can we keep our kids safe in a situation like this where they may be sharing spaces for either sleeping, eating, or activities?
Yeah, so that's a really great question. And I would call your school up and talk to them about what they're putting in place. We know that if you're going to be indoors, being further apart, that 6 feet that we talk about certainly is safer. Obviously, wearing a mask when you can, trying to have as many of those activities outdoors where there's a much lower likelihood that you're going to get infected. And then, I know masks at night when you're sleeping just really are not, that's not feasible. So I would really ask the school, how far are the kids spread apart? How are we going to manage that? And then decide if that's really going to be comfortable. And certainly if your child is old enough to actually get vaccinated, we strongly encourage all children over the age of 12 to get vaccinated. It's the best way to protect yourself at this point.
Great. And that is a perfect segue into introducing Dr. Paige Perriello, who is with us today as one of our panelists. Paige, we have the question on here, when my child does get vaccinated, what side effects might they experience, and are those a bad sign? And how bad will they be? And basically, what to expect when I am getting my child vaccinated?
Oh, great question. Thanks for asking it. Generally, kids 12 and older, who are the ones eligible for the vaccine, they at least have a similar side effect profile in terms of what we expected as the grown-ups. So anybody vaccinated out there, we give only the Pfizer vaccine to 12 and up because that's the one that's approved. So that's one of the mRNA vaccines. And the first dose usually goes off without a hitch, sometimes a sore arm later in the evening for a couple of days afterwards. I would say at least in our patients that we're talking to, particularly the 12 to 15-year-olds seem to get less of the achy, fevery, feeling sort of bad for 20 or 30 hours after the second dose, but that's certainly still possible. And we all know that is the immune system doing what the immune system is supposed to do. So it's a good sign that that's happening. It also means that it has sort of an abrupt start and an abrupt end. So that's usually what it looks like for our kids who are getting vaccinated.
Great, thank you for that. And thank you for that question. I think a lot of us get nervous about those side effects, and many of us who are adults are wondering how we can help our children as well through that. So thank you for the answer and thank you for the question. Next, I'd like to introduce Dr. Jeff Vergales from UVA Health. And Dr. Vergales, we have a question here that I would like for you to provide some insight on. When comparing the mortality rates of COVID-19 and the flu for those under 18, can you explain to us the differences and if we should be concerned about deaths that may occur from either COVID-19 or the flu? And does this mean that I don't need to vaccinate my child?
Jason, I think that's an excellent question, and one that we kind of dealt with throughout this pandemic, right? It's been something that a lot of parents have been brought up to me. And there's a couple of quick contexts with that. I think, first of all, that when we look at flu rates and flu mortality numbers, those are always hard to wrap our head around because we have not studied that nearly to the same degree as we have studied this disease and tracked those numbers in the same context. The CDC has not done it. Local health districts have not done it, mainly just because of not really needing to the same degree that we've had to trace this. So we have to kind of a lot of times rely on single center studies, regional studies that have tried to look at it and found that as a general rule, we find that influenza rates in the population below the age of 18, I want to make sure we clarify that, are probably still cause more morbidity and mortality than COVID does, but that's not by a significant margin. We find that overall, it's probably a pretty similar disease process. What are the groups that we seem to be affecting more? It's probably more likely that we're seeing in COVID, we're seeing more of the teenagers that are getting affected more so than in a normal influenza year. In influenza years, most of our admissions across the country end up being in the hospital. A lot of kids more in the younger toddler range and the infant range. That's not as much true for COVID-19 that we have seen. I want to stress that mortality numbers are for both of these diseases extremely rare, but I mean, just absolutely extremely rare. And that unfortunately they fall way, way down the list of what is going to cause a child to become very sick and unfortunately sometimes die. But that doesn't necessarily mean that it is no risk. And I think that's what parents need to kind of understand, that everything that we do comes with a certain degree of risk. The benefit, and you're going to hear this a lot of times that we talk about, is that we don't have nearly the same tools to fight against influenza-associated issues that we do to COVID. The vaccination for influenza at any given year is not nearly as effective as we've seen at preventing illnesses as the one that we have for this disease. And so if we had taken this disease just in individual context and said that we had a disease that maybe has caused 500 children across the country to die and maybe tens of thousands others to get sick, but has such a profound response to a vaccine, we would all be continuing to push the vaccine the way that we normally are. And so I think that's probably the biggest key for parents to wrap their head around when we look at the contextual kind of relationship between influenza and COVID, is that they act very similar in this population, overall do pretty well, but we have so much of a better ability to fight it with vaccination than we even do with any given flu year.
Great, thank you for that.
Jason, can I just chime in here real quick about that too?
Absolutely.
I think one of the things that we need to remember about COVID is that we actually don't know what happens in the long term. This is a brand new virus and it's really only been around for 18 plus months. And so we don't know what's going to happen in 5 years from now, that someone may have had a very mild case. And we already see this a little bit with long haul COVID. And so I think that's another thing to think about. We have this great effective vaccine that's really proven to have relatively mild side effects, be very effective to combat a virus that we just don't have a lot of information about.
That's a very good point. Thank you for making that, Dr. Bonds. Continuing down our questions that came in before we went live today, I would like to bring on Jen Fleisher, who is our vaccination project manager. Jen, we have a couple of questions here specifically about vaccines like J&J. So one of our questions come through and says, I received a Johnson & Johnson vaccine and my doctor recommended that I get a second vaccine round of Pfizer. However, I couldn't get that as I was already in the system as having been vaccinated with the Johnson & Johnson. Can you explain why I can't get that second vaccine? And also, is this even recommended to get a second vaccine right now?
Thanks, Jason. So that's a question we get asked a lot. And right now, the CDC is not recommending interchanging vaccines. And this also speaks to kind of the booster question that I see we're getting in the chat as well. So even with a doctor's note, the recommendation from the CDC and the VDH, which we adhere to, is to not administer another type of vaccine, or in some cases with the Pfizer and Moderna vaccines, a third vaccine. Now, that is all being studied at the moment, and we're keeping eyes on those studies as well as recommendations from the CDC. All three drugs are being studied right now for their efficacy in the long term, as well as the need for a booster and when that might be. But certainly from the top, which is the WHO, through the CDC and the VDH, it is not recommended, and thus we do not, we cannot allow, or we cannot administer an interchangeable, another vaccine than the complete cycle that someone has already accepted. So the piece on boosters will have to wait for those studies to come through and to determine what the recommendations will be. And as soon as we have them, then we will adjust our protocols and vaccine administration per those recommendations.
Great, thank you so much, Jen. Great multitasking there, checking out the messages at the same time. Before we move over to our live portion of the questions, we do have a couple left here from our pre-town hall questionnaire. And Dr. Bonds, I'll ask you this one since Jen was just talking about Johnson & Johnson. One question came in that says, nobody seems to mention Johnson & Johnson when we're talking about breakthroughs and hospitalizations and even death. So is this data even included in the research and in the VDH or BRHD reports?
So great question. We certainly do. When we have breakthrough cases, we always ask and confirm whether or not an individual is vaccinated. And we do try and run some tallies of breakthrough by vaccination. And generally what we're seeing is that you get breakthrough cases in all of the different vaccines. So no one magic vaccine out there at this point in time. The really great news is they also all are doing their job. They are generally keeping people out of the hospital. They are keeping people from dying. And the symptoms that people have if they do get a breakthrough case tend to be on the milder side. And many people just don't know that they've been infected. They really don't have any symptoms at all. So the vaccines are doing their job, but we are seeing breakthrough with all the vaccines. And the CDC and the state and really scientists everywhere are watching this very, very closely because of course we don't want to vaccinate anybody with a vaccine that's not doing its job. So that is data that is collected and looked at all the time.
Great, thank you for that. And Paige, we'll round out our pre-questions with you on kind of one that revolves around travel. So we talked about the importance of testing, once we get back from travel. But before we even consider traveling, if someone is vaccinated or is not vaccinated, is it safe to fly with a mask?
Well, I'd like to kind of touch on a couple things about travel, if that's okay. And there's 100 questions about going to the beach. I guess some people have some beach vacations coming up, so I'll address that one as well. Travel is always the entirety of the travel from the second you leave your door until the second you're back. So I'll address the airplane itself, but we care a whole lot about what you're doing when you're there as well. And every aspect of that travel can impact your risk factor. So flying is thankfully one of those places where masks is still really tight. I have not flown, but I understand that the airplanes are still requiring masks. So I get asked a lot as a pediatrician about children who aren't old enough to wear a mask yet. And I would say that travel makes me pretty nervous. And unless that's truly essential, I would really try to find another way to get there. For kids old enough to be vaccinated and their families who can all wear masks, I think that that certainly makes everything safer. There's no zero risk game here with travel. The airport itself is probably as risky as the airplane. And so again, you just have to think about every aspect. So if you're totally super about a mask on the plane, but then you take off your mask to eat in a food court right around everybody in the airport, then that just became a lot riskier. So and I just wanted to address the beach, which has a similar summary, which is thinking about from the beginning to the end of your travel. We really do think that outdoors is incredibly protective. And so being at the beach itself, assuming you're able to find a little spot of sand for your family that's not right on top of everybody else, being outdoors is really a safe place to be. And thinking really hard about the other things you're doing while traveling to the beach. If you're in a hotel, being sure you're masked going in elevators and going into the hotel, trying to eat outdoors where you can. But the beach itself is a pretty okay place to be with your family since it's outdoors.
Great, thank you so much for those reminders. And with that, that concludes our questions from before we started the town hall. Joe, I will turn that over to you if you don't mind taking on this live section and getting everyone queued up.
Great, Jason. Thank you. And just again, want to welcome all of our registered attendees. The chat function was left on, and that was by mistake. We knew we would be inundated if that was on. So we did turn that feature off. So we are asking all of our registered attendees who did submit via chat to please raise your hand and re-ask your question, as we will not be going back to the chat feature. And at this time, I will ask our registered attendees to ask questions of our panelists. If you'd like to participate, please click your raise hand icon or *9 if you're joining us by phone, and you'll be called on in the order of hands raised. After I call on you, please unmute your mic and we'll allow one question and one follow-up question. And if time allows, we'll host a second round of questions. And with that, our first hand raised is Rachel Hirschmeyer. Rachel, you are on with the panel. Oh, sorry, Rachel, one more time.
Can you hear me now?
We got you. Thank you.
Okay. So with a little more than half of our health district, how they're fully vaccinated, there's a lot of people who are not vaccinated yet. You guys have been providing vaccines to people for months now. So what's another way you can encourage people to get vaccines if they're still hesitant? Because obviously more needs to be done, on a national level and on a local level.
I'm happy to start with that, if that's okay. Rachel, that's a wonderful question. And I would love to encourage every single person who's on this call who has gotten a vaccine, particularly those who were hesitant before they got the vaccine, to be a vaccine ambassador. We know that one of the best things that can happen for people is to have conversations with people they trust. It can be really helpful to hear from people who are hesitant themselves, because it feels really scary to a lot of people. And so we really need to meet them where they are. And the health district has done an amazing job of physically meeting people where they are in all the places they might need to get a vaccine. But we have conversations in our office every day about the vaccine, and we're fortunate enough to give it in our office to parents and kids. And I hear a wide range of very real concerns that people have. And so finding out what the hesitation is instead of putting everybody into the same box is really helpful. And so in your communities, in your friend groups, in your school groups, in your parent groups, in your neighborhood, wherever you go, talking to people about whether they've gotten the vaccine and why you think it's important can make a really big difference.
Rachel, I'd like to add on to Paige's standpoint, because, and even be a little more blunt about it, that I think one of the messages that's been lost throughout all of this is that we can make this thing go away. And I think the hard part for people to wrap their head around is that even in the hundreds of years that we've understood viruses, maybe 100 years or so, it's been uncommon outside of smallpox that we've ever really made a virus go away. And so our pursuit always has to be, how do we control spread if this thing is going to be with us for a long time? And the word we use in circles is whether it becomes something called endemic, just like influenza is endemic every year within us. And the only way we've been able to ever do that is through immunity. Masks work really well and social distancing works really well for us to be able to control spread. But if you look at every major outbreak, the way that we deal with it is through immunity. And vaccines are a great way to provide immunity. Getting it is also a great way to provide immunity, but we don't want that. We don't want people to get it. We want people to be able to understand that that immunity is the only way that this thing is going to go away. And enough people have to be immune for all the vaccines to be able to work and for this disease to become endemic. And that's a hard thing, I think, for people to kind of wrap their head around.
Thank you.
And just as we wrap up that one question, I will touch on what Paige said about becoming an ambassador. You can become an actual ambassador. The Virginia Department of Health does have an ambassador program. And so if you are worried about starting that conversation or having the right information or the latest updates, this particular program will actually give you the tools to do just that. So if that's something you're interested in, please let us know, and we'll be happy to hook you up with that link where you too can become a VDH ambassador.
Jason, I'm so sorry, but I have to add, if you either feel stuck in a conversation or even if you don't want to have the conversation, please encourage everybody you talk to talk to their primary care provider about the vaccine. Usually we are a trusted source of information. If somebody is still seeing us, it means they usually trust us with the health information. And it's a really great place to go. A lot of primary care providers have the vaccine, and if they don't, they know where to get the vaccine. But for a lot of people who have questions, they haven't actually talked to us yet. And so it can be a really great default to just say, you should really talk to your provider, whoever they are. And we're always happy to have those conversations.
Great, thanks. And thanks, Rachel. And Rachel is from NBC 29. And I would like to ask any of our other media friends joining us today, if you wouldn't mind just identifying yourself and your organization, that would be terrific. And next we have Laura Carpenter. Laura, you're on with the panel.
Hello, sorry, it took me a minute to find my unmute button.
We got you.
All right, well, thank you. My question is about healthy kids under 12 in an indoor sports camp. So inside a really large gym or inside a smaller school gym. In my case, for my child who is not yet vaccinated, of course, they're not required to wear masks while they play sports. And I'm trying to understand how to assess his risk with Delta. It just feels high in that situation, considering they're breathing a lot while they're playing their sports. And I understand it's a big gym and I don't know how much air circulation I can count on. I understand my child's risk is very low for having a bad case of COVID, but I would prefer, if I can, for him to avoid infection. We've gone this far without it so far as we know. And so I'm just trying to make some decisions.
Laura, I can probably start with that. I think that's an excellent point, and something that you, as obviously as a parent, think not only just every time you send your kid to a camp or to a school, but every time you walk outside, and not even risks of infection, but just every type of risk, right? You're assessing at that camp. Are they doing a good job with, allergy maintenance? Are they doing a good job with anything really? And so it kind of falls into that same category of a risk profile. And I think there's a couple of common themes that we can pull out of what we're seeing when we talk about kids that are picking things up. One, it's, obviously big open gyms are a lot better than small confined spaces. And so you can kind of look at your individual camps and kind of figure out if that is something that they have, is whether or not it's going to be predominantly outdoors or in big open places. The other thing that is important to understand is that oftentimes we find that, the time of actual playing sports is probably not where transmission is occurring. It's really occurring in huddles and social events and times where the teams are actually all sitting around in close proximity to each other, as opposed to brief passings of things. And I don't think Delta is overall going to change that dynamic on a personal scale. It just may unfortunately change that dynamic on a population scale. And I think that's the thing that we understand we deal with contagiousness, is that really in an individual person, it's not that they're more likely to catch it with the same activities that they were doing 6 months ago or 9 months ago. It's whether or not if a situation arises where it's going to spread, it can spread to more people at one given time. And so I think, my advice to you on that standpoint is to really kind of look at what you would think is the most likely place that we're going to have issues in your child's school or camp environment. And that really is going to involve where kids are spending close proximity of time in very close quarters. That's really where we're seeing the absolute vast majority of this disease spread from one to another, and try to figure out ways to either limit that or mitigate that some way. And hopefully the schools are doing that and the camps are doing that.
Okay, and so can I just follow up quickly? Inside a school classroom where some children are masked, which is the other situation for my child, that would be a potential higher risk situation than in the gym.
Yeah, we have loads of data now coming in from the pandemic of the last year that mitigation strategies in schools work. And that not only do they work, but schools were not the mass spreader events that your house would be, that family gatherings would be, that other things like that otherwise exist. And it's why we as a kind of a community health organization and pediatricians and whatnot have strongly recommended adhering to the CDC guidelines of universal masking in schools, at least to start. At least that's as we're getting into schools right now, with the clear reason that we know the mitigation strategies work. The CDC allows us to be able to do that and keep kids in school as much as humanly possible, which is the most important goal that we're otherwise doing. It's not because we think we're going to have a bunch of really sick kids on our, all of a sudden presenting to us. It's because we know that if transmission is going to happen, it's going to be in close quarters. And so that's why we have made the strong recommendations to schools to do that, because it allows us to do what our eventual goal is with this population. It's not to prevent morbidity and mortality, although that's obviously very important. It's keeping these kids in school as much as humanly possible.
I just wanted to add one little detail to what Dr. Vergales was saying, which is, everything we do as parents, we all make our own rules for parents. And I think it's important for you to also know that kids under the age of 12 did everything in the world with a mask on last year. And we don't think it's risky for them to be in the mask. And that's been a confusing source of information in the last month. So if your comfort level is to send your child in a mask, we don't think that's dangerous to them to be in that mask to do those activities.
Great. And our next question comes from Barb Franco. Barb, you're on with the panelists.
Hi. There are two pieces to my question. I was found out I was exposed to somebody who may be positive. She's getting tested. And I called Blue Ridge Health District and they said to quarantine for 14 days. Get tested in 3 to 5. One is, if she comes back negative, what are the percentages of the test not giving the right result? And the second question is, I'm a little confused over quarantining versus masking for 14 days. And my concern is I'm going to be in a group setting over the weekend with an immunocompromised person.
Yeah, so that's a tough situation. So let's take the bits of it. So the first part with regard to the likelihood that the test your friend had is what we call a false negative. That is, it gives a negative result if that is what happens, but she really is infected. And that depends a little bit on the type of test. If she went to a place that's doing what we call PCR tests, which are really the most accurate ones we have right now, then that's pretty unlikely. That test done in a medical setting usually is pretty close to being, if it's positive, you're infected. If you're negative, you're not. If she got a rapid test, that's an antigen test, that one's not quite as accurate. And if she had a really good exposure that we know of, so for example, she rode in a car with somebody who ended up having COVID, and she was in that car for several hours or even an hour, and gets a negative antigen test, I might recommend that she get a second test just to make sure, because that's a high risk situation in a car, recirculated air, close quarters, probably unmasked. So that's, it just depends on what test she had. If it's a PCR, it's pretty accurate and I would believe the results. Assuming she got it at the right point in her infection. There's all these caveats associated with it. So what should you do in the meantime? Well, gosh, if I were going to go spend a long period of time with someone that I knew was immunocompromised and I'd had a potential infection, I might think about postponing that visit if I could until I knew for sure whether or not I was infected with that. If you can't, for whatever reason, then I would try and hold my visit outside where we know it's safer. I would for sure wear a mask because I want to keep my germs to me at that point in time. And I would probably try and do all of those things, be outside, wear a mask, make sure I stay 6 feet from the individual. But if I could, I would certainly try and reschedule it for a week or two until I knew the results of my friend's test and knew the impact it was having on me.
And our next question comes from Lisa Torres. Lisa, you're on with our panel.
Hi, good afternoon. Thank you. I apologize if I missed this earlier in the broadcast, but I was just curious if there could be some clarification. I've heard some confusion on guidance regarding students spacing indoors versus students spacing outdoors at school, and just how to deal with that. I anticipate a lot of questions and concerns from parents as students are returning to our schools here soon. So I just didn't know if there had been any clarification on any of that, or if you all had anything to recommend at this point. Sounded like it was contradicting a little bit.
So Lisa, I think there's two ways to kind of think about that. The first is that as a general rule, the distancing guidelines as far as space between will not be done at the behest of kids not being in school. And so what that means is that there's going to be no guideline that would then eliminate the potential of kids in school. And the American Academy of Pediatrics and the CDC, as a general rule, have come out very strongly in saying that really the goal is just to space kids out as much as possible. And that's what a lot of schools are really undertaking, is to saying, how can we just maximize the use of space that we have without the school itself? Because what we don't want to do is create situations where we keep to physical limitations of space that then keeps kids out of the classroom. And that was kind of the purpose of a lot of those guidelines. That's a little different than when we come to what we talk about, where we would define somebody as a close contact. And those numbers are shifting a little bit because the great, kind of contact tracers at the Blue Ridge Health Department have had kind of an unenviable task of sometimes figuring out who are the kids that we otherwise have to be worried about. And the physical distancing is then affected a little bit in the K through 12 area by whether or not those kids are wearing masks with the new guidelines that we otherwise have. And are also going to be affected a little bit by whether or not it's indoors versus outdoors, although as a general rule, we don't tend to think of those individual environments differently, just knowing that kids are at much lower risk if they are outside. But when it comes to, what we've been advising schools, we say, well, kind of put away the tape measures and start trying to figure out the tape measures, because what we want to do is space kids out as much as possible. 3 feet is fine. 6 feet is even better, but not at the behest of keeping kids in the actual classroom.
Lisa, did you have a follow-up? And Lisa, you are muted.
Thank you. Sorry. We absolutely want every student who chooses to be back in the classroom. So we are fully supportive of that and all of the mitigation practices that we worked so hard last year to get ready to implement. And I guess the confusing part, and I just heard tidbits of this, was I guess what needs to happen outdoors for students, and if there is a contact, and even if kids are masked outdoors, that the distance, if a student was even 6 feet apart, there would be concern outdoors if we're tracing a positive case rather than indoors. And even if they're 3 feet, they might not be traced. I guess there was just discrepancies on some of that guidance that was given out. And I just didn't know if you all had any updates or had any thoughts on that.
Yeah, I know the guidance has been, it's a pretty confusing time right now. And I think I'm just going to beg for a little patience as we work through at the beginning of the school year. As Dr. Vergales and Dr. Perriello have stated, really, it's critical that we get these kids back in the classroom. And so we are going to have a little bit of finessing to try and keep kids in the classroom so that they can learn. We know kids, particularly younger kids, really do better in a classroom setting than sitting in front of a screen. And so I think that's driving some of the confusion. And I am sure we'll see some clarifications as we move forward. But our case investigators and contact tracers will work through it. And they're mindful of all of the changes that have been happening and are coming down.
Lisa, thank you for all your hard work to help get kids back in school last year. I think sort of the summary of where we're feeling right now is just what we feel like is safe, and which is really important, is that we feel really good and safe about having kids in school masked and changing to the 3 feet, which I know is a difference between 6 feet. The contact tracing definition has technically not changed at this point, except for in the classrooms, which is going to be a huge help to us this year because it means we don't have to send kids home if they've been exposed in the classroom. And we still believe absolutely that being outside is a much safer place to be. So as you all continue to work through your strategies for the year, just knowing those fundamentals of what we think is safe is important. We'll have to tease out all the definitions and hope that at the state level, maybe we'll get a little bit more guidance that will help us put that into place in time. But in terms of what is safe, those are the things that we still really feel are good in keeping our kids safe and in school.
And next up, we have Kristen Fritz. Kristen, you are on with our panel.
Thank you. My question is, what do we do if our school district is not following the CDC guideline to have everyone masked?
So to the best of my understanding, it is at least optional in every school. And I realize that's it's a hard sell if you've got a kid of a certain age, or probably any kid, if no one else is wearing a mask and they're sent to school with a mask. So I think as a parent, you should do, what is the best thing for your kid. And I certainly, if I had younger kids, would be sending them to school in a mask. We certainly are in close contact with all of our schools and work with them to implement the absolute best guidelines. And I'm actually going to turn over to the pediatricians who perhaps have some suggestions on how to handle the peer pressure associated with a situation like that.
I'm actually not concerned about peer pressure. I'm concerned about the fact that I have a 6th grader, which means there are both 11 and 12-year-olds in the class, and he is 11, so he is not eligible for vaccination.
Yeah, I mean, it's a tough situation when you've got that straddle overlap and a kid not eligible for vaccination. We know the tests are on, or the studies are going on right now, and hopefully it will be approved for younger age kids shortly, but I don't know when that will be. They haven't given us any sort of time frame at this point in time.
I'll just pipe in and say, I feel your pain. I have 3 kids who are all under the age of 12. And there's no perfect answer to this. I do want you to know that there are several pediatrician groups that are advocating really strongly to the school systems that have made masks optional. So we are making phone calls, we are sending letters, we are doing what we can to suggest that that it would be a better way to start the year to have everybody in masks. We are hoping again that we may get some guidance in the next week, which doesn't help the schools that are starting next week, which are all the schools that have gone to optional masks. We are trying to help in every way we can because we feel the same way that you do. And we'll continue to advocate for the health and safety of all the kids in the district. So we're trying.
And right now we have about 6 more people with their hands raised. I will just make this announcement. We are approaching the 2 o'clock hour and we will not be doing a subsequent round of questioning. And we'll also limit it to just 1 question with no follow-up. And next we have Alexander Brisker. Alexander, you're on with our panel.
Hi there. A lot of restaurants I know have indoor dining open, and they also have outdoor dining open, but it's kind of in their patio area where other individuals will be there as well. And I was curious, what are your thoughts on having a meal, outside on a patio, but you're still in with other guests? Any thoughts would be appreciated. Thank you.
So the first thing I would say is, generally the risk in our community, depending on where you live, we're hovering between moderate and substantial. So we're, in terms of the United States and even Virginia, this health district certainly has increasing transmission, but is still generally low. So that's sort of a baseline statement. If I were going out to eat, where would I select? I would probably choose outdoors for lots of reasons. One, I just like sitting outdoors. I find that just a really enjoyable experience. And I think it's fine to have other people around. I would, if I have a medical condition that makes me vulnerable, if I haven't been vaccinated, that changes the story, I think, at that point in time. If I have a condition that's going to put me at risk of being in the hospital, if I got a breakthrough infection, I think really hard about what my options are. Or if I'm taking care of someone in that medically vulnerable or unvaccinated, then again, I would think you can lower your risk in either setting, either indoor or outdoor, by wearing a mask at all the times except when you're eating. It can be uncomfortable and awkward, I get that. But that's the best way to lower your risk if you want to go out and enjoy that dining experience. And we have so many lovely places to eat here in our community. I certainly understand why people want to do that, but I think if you're going to select outside, I think that's a very reasonable option.
And next we have Michael Joy. Michael, you're on with our panel.
Thank you. I have just a quick question about touching on travel, just seeing some loved ones and some family members before the start of the school year. Is the idea, because with small children not being eligible for vaccination, do we test, I'm looking at my siblings who also have small children. Should we all test individually before we convene? And then when they get back after this trip, do we test again before they go to school? Or what's the guidance on, or should we think about postponing, just given the potential for vaccination opening up this fall?
Well, Michael, that's a tough question as well. I would first of all re-echo what Dr. Bonds has said, is that we don't know a timeline when vaccination is going to be in the under 12 range. We believe the trials will probably finish sometime at the end of September, beginning of October. And so I would expect that it's going to be late fall, potentially early winter before, at a minimum, before we would see that. I would stick by a couple of things that I think doing asymptomatic screening testing in people who are vaccinated is probably not a smart move. That depends a little bit on what area you are in. With looking at what the pre-test likelihood is of that being positive, that's a little bit of kind of a weird statement. But what we don't want to do is deal with the potential for false positives in individuals. And so if you're bringing the children into a highly vaccinated group, and that highly vaccinated group is not exposing themselves to many others, i.e. you're not like them, going from neighborhood house to neighborhood house in new environments, and you've overall decreased your exposures, going and visiting a family member or group who are, again, where all eligible people are vaccinated, would be something to be considered very low risk. And I think a testing strategy is probably not going to change that risk profile very much in that situation. That, of course, changes as the number of unvaccinated people rise in that group, and depending on, to some degree, what you're doing at the location in which you are going and what's going on in the location of which you are going. But you can kind of play with the variables a little bit, kind of all you want. But as a general rule, going to visiting one family member that's, a family member household that's highly vaccinated, it would be considered a low risk population or low risk situation as a general rule.
Great, and we have about 3 more hands raised. And again, this is the last call for questions from our registered attendees. Please click the raise hand icon or *9 if you're joining us by phone. Next up, we have Nick Gilmore. Nick, you're on with the panel.
Hey, thank you. So cases statewide seem to be going up. I know in the New River Health District and the Roanoke City, Allegheny Health District, cases are going up there. And officials there have said, have kind of linked that to the Delta variant. I was just wondering if you guys are seeing something similar, and if not, are you expecting a spike in cases, and how exactly are you all preparing for that?
Yeah, so great question. You can actually look at the VDH data page, and you can see the variance and the percentage by region of the country. So we're in the Northwest region, and if you look, we are seeing Delta variants in this area. I think every place in the state is seeing Delta variants. There's also, if you scroll all the way down, and it's a little tricky to get to, you have to go to the data page and then click on the icon on the far right-hand side, and then look for the tab that says variant of interest. If you scroll down, it will show over time the percentage of each of the variants. And you can see that for the state of Virginia, it's primarily Delta. I mean, I think we can make the assumption that most of the cases that we are seeing in our area are likely Delta. Now, the caveat to that is that we don't do genotyping on every single case. We do it on more than we used to. And in this area, because we have UVA and all of their great facilities, we do a fair amount here. But there are sometimes we don't have a sample that has enough to do that. Sometimes it's sent to a lab that just doesn't do genotyping. So this is really what we call a convenient sample, but it's definitely in the Northwest region Delta.
And Nick, I can speak to what our plans to address that are. We are ramping up, as Jason mentioned, our testing capacity and abilities so that we're offering free testing more frequently during the week. We are also have been and continue to increase our mobile units presence in neighborhoods and our homebound presence for home visits so that we can kind of really meet the needs of those who have been either slow adopters or hesitant to be vaccinated, and continue to offer a mass vaccination site where we're working on adjusting the hours and the offering to meet folks where they would otherwise not be able to get a vaccine either from timing or location. So we have had our eyes on this and continue to ramp up those efforts in those three areas.
And next we have Laurel Williamson. Laurel, you're on with our panel.
Hi, thanks for having this town hall. This is great. Quick question. What symptoms should we be on the lookout for, both for adults and for kids with the Delta variant?
I can talk about the kids at least. The symptoms for Delta variant are not different than the symptoms for previous variants of COVID. It is what has been extremely challenging for pediatricians because the symptoms are typically very mild, and often sometimes kids will have no symptoms. So, but runny nose, cough, fever, sore throat, those are some of the most common symptoms we see in the younger children. Only the older teenagers usually get that loss of taste and smell that some grownups have experienced and heard about, but it's generally mild symptoms of illness like you would have seen in previous years with any other kind of illnesses. And knowing the history of those year round can be particularly helpful when we talk to people about COVID, because often it's the kind of environments you've been in, as well as the symptoms that we take into account. But there is no way, and anyone with school-aged kids is well aware of this from dealing with all of the pediatricians last year, that we simply cannot tell the difference between a cold and COVID because they look identical. I should say that is without a test.
I'll just chime in and say it's very similar for adults. You can have, particularly if you're vaccinated and you get what we call a breakthrough infection, it's really often mild respiratory types of symptoms. And so it's really how suspicious are you for the COVID? And right now we're very suspicious, obviously, because we are seeing an increase in cases.
And our last question comes from Sarah Fritz. Sarah, you're on with our panel.
Hi. I wanted to go back to the kids under 12 in the classroom. So obviously all unvaccinated. And I guess, I mean, I plan on having my kids wear masks and they do fine with that. So that's not really my concern. I guess I'm just wondering sort of how it changes the equation for other people not to be masked. How much does that sort of increase the risk, or is just having them wearing masks really, pretty effective?
Yeah, I can probably take to that. I mean, clearly masking as a mitigation strategy is most effective when everybody is doing it. I mean, that's an easy answer off the top, is that we think a mask probably protects you a little bit, but I would still argue that probably the most of the mitigation strategy from masking is protecting someone else who is sick from spreading it to other people. But I to give you at least a bit of optimism, in this, to understand that even the schools that are choosing to have masks as being optional have other layered mitigation strategies in place. And I think that's an important thing that I want everybody to remember. In a perfect world, I think, we could go forward with other mitigation strategies that kind of continue to understand the goal of keeping kids in school. But things like that a lot of the schools have been working on with trying to figure out how airflow works, cleaning regimens, making sure about classroom density and population density within the school, identifying symptoms of kids who are sick and keeping them out of school are all very important mitigation strategies as well. It's not just mask is, super safe, and without mask is super risky. It is one tool that allows us to continue to control mitigation spread. And so I think making sure your school is continuing to do the other things are just as important. We have evidence throughout the spring. I mean, there were plenty of schools that did not have masking in the spring across the country, not thankfully in this health district, but across the country. And I think we learned a little bit from that masking is an important thing that works, but it is not the only thing that works. And so making sure that you understand that we would love for everybody to be utilizing it right now, but as long as the school is also undertaking other layered mitigation strategies, it's the layering of those mitigation strategies that seems to be the most effective tool for curbing spread.
And we did have one more hand pop up after I said final, but this will be our final question from Carmen Chandros. And if anybody else has additional questions, Jason Elliott will provide information on how you can ask your inquiry to BRHD staff. Carmen, you're on with the panel.
Okay, well, thank you. Thank you, everybody, for doing this. I do work in the school and I do work with the special ed, and I just wanted to, just ask if there are any cases of children under the age of 12 that are that got sick and from the Delta variant, and if there are any treatment or facilities of treatments available for those kids, or for any kid that can get sick from this variant. Did you hear the question? Sorry.
I was wondering if, Paige, do you want to take that, or I'm happy to?
Yeah, I mean, I think that, yes, absolutely. We have many kids under the age of 12 who are getting COVID, and like Dr. Bonds suggested, almost all the COVID we see right now, we assume to be the Delta variant. So we are very fortunate to have most of kids, especially under the age of 12, continue to have mild illness. But we are watching it. We are watching it really closely. We're seeing more cases, and we're having reports nationwide in some places like Louisiana and Texas and other places where cases are really, really high from our intensive care colleagues and pediatrics who are seeing some sicker kids. But right now, locally, what we're seeing is the Delta variant looks a lot like what the other variants have looked like in kids with fairly mild illness.
I think I made this comment to a similar group of this just a couple of days ago also, that if we can also learn something a little bit from Europe, which is a couple of weeks ahead of us right now when it comes to the spread of the Delta variant, at least when it comes to children, is that exactly what Dr. Perriello said, that we are seeing that it probably does not cause a more severe illness in children. I can't say that with absolute certainty, but if we're taking people that have published a lot more cases of it than we have here right now in the States, it just does seem to be more contagious. It has an ability to spread to more of those children, but it does not appear that we are causing more, it causes a more severe illness. We will obviously could change that decision or change that opinion very quickly in the next couple of weeks. But this is kind of pulling from some people who have seen surges of Delta even prior to us.
Great, thanks. And that concludes our Q&A portion, and I'll hand it back over to Jason Elliott to conclude the town hall.
Great, thank you, Joe. So thank you all for those wonderful questions. We know that questions don't just come up between a 1-hour town hall. They come up in the middle of the night, and they come up on the weekends, and they come up at all those times. So if you do have questions, make sure you write those down and you call our hotline Monday through Friday, 8 to 4:30 p.m. We have people that are ready to answer your questions, help you get your vaccine appointments, or tell you when testing is available. If email is what you prefer, then you can shoot us an email, which you see, well, you don't see on the screen, sorry. It's brhealthddistrict@gmail.com. So feel free to reach out to us at any time, and we would love to answer your questions. With that, as always, we want to thank our panelists, Dr. Denise Bonds and Jen Fleisher from the Blue Ridge Health District, as well as Drs. Vergales and Perriello for representing our pediatricians in the area. And of course, the city of Charlottesville for helping us get to you this town hall and share with you all of the updates and answers that we have. We continually thank all of our pediatricians and providers, as well as our educators and parents who are working so hard to make sure that our kids are safe and healthy as we head back into school. And most of all, we want to thank you, the community, for supporting us and supporting each other as we put COVID behind us. So continue to get vaccinated, continue to wear your masks. If we don't see you at one of our upcoming vaccine or testing events, we look forward to seeing you next time for a town hall with the Blue Ridge Health District. Thanks, everybody.